Good afternoon, friends. I'm Christine House. I'm a local realtor, captain of Team Mama Rose, and the marketing and outreach chair for the Myrtle Beach Walk to End Alzheimer's. I'm here today with Miss Patty Younts, and she is the caregiver to her husband, Howard, and she is the team leader, team captain of Team Howard, and our AIM Advocacy and Impact Movement Committee Chair. And we're here today to have a little conversation about AIM. We first would like to let you know that we realize it's a very unsettling time right now, and it's difficult for all of us. It's affecting us on all different levels. If you're struggling emotionally or mentally and you have the need to talk to someone, please do. If you don't know where to go or you don't necessarily have someone to talk to, inbox me and I will be happy to forward you some contact information for your specific needs. And I want to thank you, and Patty would like to thank you also for giving us your time and your attention. Patty, I may know you, but please tell everyone a little bit about yourself.
Well, my husband was diagnosed in 2012 at the early age of 60 with dementia. And he and I attended our first walk in 2014. And it was then that we knew we needed to be more involved with the Alzheimer's Association. In 2015, then we formed Team Howard and have been walking in the walk every year since. I have also been his full-time caregiver since 2015. It was in 2017 that I became a member of the Alzheimer's Congressional Team, and that was to become an advocate and to help raise our elected officials' awareness and get their support for the Alzheimer's Association's public policy goals, and to make them aware of the severity of this disease and to bring it to the forefront. I've attended the South Carolina State House Day and the Advocacy Forum in Washington, D.C. then every year since 2017. Unfortunately, this year it was canceled, and you know, we didn't go to Washington. We did get our State House Day in, though, this year. Part of my personal mission is to raise awareness of Alzheimer's and the fact that it does affect people younger. You could be in your 40s, you could be in your 50s, but that is one of my goals, is to bring awareness to this disease, and in addition to the fact that you can be younger.
Okay.
You know,
Go ahead, I'm sorry.
That's okay. If I had been more aware 12 years ago, we could have gotten treatment started for Howard. And so I think that's why it's so very important that we bring awareness.
Absolutely, absolutely. Now, tell me a little bit about AIM. So, you know, I know about AIM, but not everybody knows what AIM is, or what exactly the purpose of AIM is.
Right. As you said, AIM stands for the Alzheimer's Impact Association. It's the sister organization of the Alzheimer's Association. It's a nonpartisan, nonprofit advocacy organization, and they work in conjunction with, or in association with, the Alzheimer's Association. And that's to, again, enable them to bring to the forefront with our lawmakers the need for policies, for laws, for funding. Big time funding is very, very important. Okay. So AIM is the sister, and it is a 501c4,
right,
which does allow them to engage with lawmakers.
That's great. Okay, has there been any recent progress as a direct result of AIM's advocacy?
Yes, there's been many wins since AIM was formed.
Terrific.
Again, going back to the younger onset, I'm very excited that Younger Onset Alzheimer's Disease Act was passed and became law at the end of last year. Right now, we're working on improving hope for Alzheimer's, and that's another act that's in the works. Research funding, as I mentioned a minute ago. The research funding for the NIH has increased, and I need to look at my number for that. It's increased from $448 million in 2011 to $2.3 billion by 2019. So because of the AIM and advocates have a lot to do with influencing lawmakers. They will listen to advocates, but that is a huge increase in research funds for the NIH.
Okay.
Now,
and how does it benefit? Sorry, how does it benefit the community? Like what programs or benefits that directly come to our specific community or communities like ours?
Well, going back again to this younger onset, I'll use that as an example because it is the most recent, and I think it's one of the very important acts that was passed. What that does now is it gives access to people under the age of 60 to be able to have the services and supports under the Older Americans Act. It could be such things as in-home services, transportation, nutritional programs, caregiver support. Prior to this act, if you were diagnosed under the age of 60, you did not qualify for those services. So you can see how very important that is, that these people, a lot of these people in their 40s, they still have children and have children at home. They still need to work. They need those services.
Absolutely.
And then improving hope. The HOPE Act actually went into effect in 2017. And what that does is it gives clinicians the ability to do care planning for dementia patients, and that is through Medicare, and they would be paid through Medicare. But in that first year, there was, I think, less than 1% of the clinicians using that. So the improving hope now is to be able to educate clinicians that this benefit is available through Medicare, and we need to get more care planning done for our dementia patients and with their caregivers.
Absolutely. Okay, let me ask you, how can people get involved to make a bigger impact?
Become an advocate. Do what I did and become a congressional team member. We now have a state champions program where you can get more involved with our state representatives. Those things are great, to meet with the elected officials, letters to editors. We always get excited when someone can get a letter about the disease in the paper. You can engage through Twitter, Facebook with our elected officials. Tell them your story. There is nothing more powerful than telling them your story and telling them why a particular, as in the example with the young girl, and said again, why that's so important to people under the age of 60. You can attend political events and speak, on behalf of the Alzheimer's Association. Coffee with your congressman. Our congressman in District 7 here is Tom Rice, and I've done an on telephone coffee with the congressman and in person with him. It just makes such an impact, and you can do those things. Do what you're comfortable with, but you don't have to do it alone. Someone that's an advocate already will be able to go with you and help you get started.
Okay. Now, I know that right now we're in a strange kind of time, and social distancing and a lot of public events are canceled.
Yes.
But are there some events that are typically planned for AIM? Like the State House, like you said, DC,
Mm-hmm.
or is there, what the website? Like I know there's a website. Is there can we give them the information on the website to direct them where to go to find those events, when they are
Right.
starting to be scheduled again?
Right. The big event for AIM is the Advocacy Forum in DC. And then, of course, our state program, we have State House Day. And then the things that I mentioned a little bit ago, that's how we are continually active, is by forming those relationships with our representatives, following up with them. Right now, because of the coronavirus, and I'm sure many people have heard on TV about scams going on.
Yes.
There's a new bill from the Alzheimer's Association, and this is being driven by AIM, that would provide improved training to prevent the abuse to those with Alzheimer's and other dementia. Well, right now that's real important, because as
Absolutely.
these checks are coming out or this money is coming to people, that's a real hard, that is a time when our seniors become
Scary.
vulnerable.
Yeah.
Yes, it is. It
Absolutely.
really is. But the I got off track with that.
The
Christina,
website.
oh, you wanted to know about how to
Yeah.
find more
I'd like them to be
information.
able,
I'm
because
sorry.
we give them so much information,
Yes,
but I would like them to be able to go to the website and
yes,
see, and then maybe know about the membership. I mean, the
yes,
membership I think is key, because they
yes,
will get updates, and you can elaborate a little on that, with
yes.
the website.
Well, we have a state advocacy manager, and his name is Ben Culbreth. And I really think that if you wanted good information and to talk to someone that is a staff member, that Ben is doing an excellent job. As a matter of fact, right now we have some webinars going on every Thursday, and those, if you've missed the first two, they have been recorded, and you could go back and look at those. Those are a good way to understand what goes on with advocacy and how to advocate. Now, Ben can be reached, if you can't, a phone number, I guess maybe I should give in this. It would be 803-888-5628. But if you would rather go online and just take a look around first at advocacy, you can go to alzimpact.org, or you can go to the South Carolina chapter and go to advocacy, and it will also give you information on becoming an advocate. Now, Ben, I'll go ahead and give you his email, but you can find it online. But it is BP Culbreth, CULBRETH @alz.org.
Awesome. Okay. Now, if they want to volunteer or become a member, how would they go about doing that?
Well, if you want to volunteer, again, Ben is
Especially for your chapter, your committee.
Yes. Again, Ben, and if you wanted to be on my committee, I do have one other person, and that's Judy Maxwell on the committee with me. But we would welcome you, walk you through everything, and you could either reach out to me or you could reach out to Alexis.
Okay.
Alexis Watts, who is, of course, our director of
We're going to
development.
post all of their contact information below our video when we're through.
Okay, great.
And the donation to become a member for the year, tell us a little bit about that for AIM.
It's $20, and that helps with supporting the work that AIM is doing. There is a lot that goes on with getting to those representatives. It could be a dinner. It could be, I mean, you know, a lot of things go on to try to get their attention and their support. And that $20 then allows you to, you can have a newsletter that keeps you updated. I get a weekly brief that tells me what is going on in DC, what's happening, what is AIM doing.
Right.
So, you know, they're very good with updates and to let you know what's going on. And as a matter of fact, going back to this, the new prevent elder abuse, we just sent out letters and tweets to our representatives on Wednesday, asking them to support that when it comes up in this, well, what's it, the next, not budget, but it's going to be another, what am I trying to say, rollout of money. What are they calling
Like
that?
a funding.
Yes.
Okay.
Yes. And they're also asking for expanding access to credit for nonprofits. You know, our nonprofits
Right.
are hurting right now too.
Yes,
just as
all
our
of them are.
businesses
Yeah, but we're trying to
They
spread
are.
the love, you know, right now.
That's
Okay.
exactly right.
What I would like to close up with is if anybody had any questions, and we were live, but because we had to record
Yes.
it, what we're going to do is we're going to let everybody post questions via Facebook and in the comments section. So if you have any questions for Patty or I, please don't hesitate to ask. If it's something that you are, you know, about what we discussed earlier, the mental health aspect, or something you really just don't want public, you can inbox either of us and we'd be happy to help you out. Typically we would have a chat bar. We will, you know, at another time we would have a live video and you could chat with us. But I want to thank everyone for joining us and stopping by to watch our video. And I like to say, Patty, you're a true champion and I admire you. You are, you're an unbelievable caretaker, and your advocacy, I couldn't be prouder of anybody to watch you and have, you know, you're a good role model for me. So
Thank you, Christine.
you're awesome. And I love you, girl.
Thank you. Love you.
Thank you guys for your time. We hope you have a wonderful weekend and stay healthy and well. And we're grateful for you giving us your time today. Okay, Patty, would you like to say anything?
I'm just basically what you've said, Christine, that we appreciate your time for watching this recording. We're sorry we couldn't have been live, but you know, technology sometimes will do that. But if there's anyone that we can help out there, yes, please reach out. This is a tough time. And as their saying goes, right now, we're all in this together.
Absolutely. Thank you so much. And look for the information below. And anything else we can help you with, please don't hesitate to contact us. Have a great day.